the end of the day, we may learn the estimated cost of the Republican health care plan and how many people it will cover. The nonpartisan Congressional Budget Office is studying the impact of Obamacare's replacement. The analysis is expected to show that fewer Americans will have health coverage under the proposal. House Speaker Paul Ryan told our John Dickerson he does not know how many will be affected. Nancy Cordes is on Capitol Hill with the importance of the CBO numbers. Nancy, good morning.
Good morning and welcome back. Yes, that's a lot of pressure to place on the Congressional Budget Office, which crunches the numbers for all big pieces of legislation. Already this weekend, administration officials were out in force arguing that no matter what the numbers show, they're wrong.
We will see what the score is. In the past, the CBO score has really been meaningless.
GOP leaders insisted Sunday their new health care plan is bound to be cheaper and cover more people than whatever the Congressional Budget Office says.
CBO has been very adept in not providing appropriate coverage statistics.
Outside groups like Brookings and Standard & Poor's have already predicted the Republican plan could lead 10 to 15 million Americans to lose coverage because it scales back Obamacare's subsidies, cuts Medicaid, and eliminates the individual mandate.
How many people are going to lose coverage under this new?
I can't answer that question.
House Speaker Paul Ryan told Face the Nation the plan will unleash market forces that will boost coverage eventually.
What we are trying to achieve here is bringing down the cost of care, bringing down the cost of insurance, not through government mandates and monopolies, but by having more choice and competition.
But he's facing resistance from some Senate Republicans, like Tom Cotton of Arkansas. He says the party is taking a huge gamble on a rushed and untested proposal.
And I don't want to see the House majority put at risk on a bill that is not going to pass the Senate. That's why I think we should take a pause.
Okay, folks.
Republicans are still encountering opposition at town halls back home, too. Democrats argue the bill shrinks aid to the poor, even as it cuts taxes for the wealthy that were imposed to help pay for Obamacare.
This really has nothing to do with health care. What this has everything to do with is a massive shift of wealth from working people and middle-income people to the very richest people in this country.
The head of the Congressional Budget Office was chosen by Republican leaders, which could complicate their efforts to pan his calculations. And this CBO score could be critical, Gayle, to determining whether skittish Republicans get on board or not.
All right, we're all watching. Thank you very much, Nancy.